Welcome to the Deep Dive. Our mission is pretty simple. We do the hard work to give you the intellectual shortcut to being well-informed. Today, we're taking a deep dive into a really powerful class of medications, the PCSK9 inhibitors. Now, these were first designed as a precision tool to fight heart disease, for people with dangerously high cholesterol. But the research we've gathered shows their impact is, well, it's way broader and honestly far more surprising than anyone expected.
That's really the fascinating part. We're looking at a cholesterol treatment that might actually move the needle on major neurological conditions. We're talking about things like stroke, maybe Alzheimer's disease, and even ALS.
Wow.
Yeah, the scientific community is building this huge win column for these drugs, and it spans everything from the heart to the brain. But, and this is a big but, we are dealing with incredibly complex systems. Some of our sources use these advanced genetic studies, and they give us a glimpse into the long-term effects. And while the upsides look tremendous, they also raise one very specific flag, a note of caution about the risk for Parkinson's disease.
And that is exactly what we need to unpack for you. So the central question is this. What happens when we use this powerful tool to aggressively lower cholesterol in the body? And how do those chemical changes ripple through the most delicate organ we have? The brain. Let's trace the journey, starting where it all began. Okay, so let's start at the beginning. If you followed cardiovascular health at all, you know the focus for decades has been on low-density lipoprotein cholesterol.
The so-called bad cholesterol.
Exactly, and that's what PCSK9 inhibitors were built to do, right? To hammer that number down.
And they are exceptionally good at it. I mean, the data is now crystal clear. If you aggressively lower this type of cholesterol, you directly lower the risk of major cardiovascular events, heart attacks, things like that.
So the old thinking of just getting it low enough is gone.
It's completely gone. Modern guidelines have really embraced this idea that lowest is best. For patients who are at the very highest risk, doctors are now shooting for incredibly low targets, levels below 55 milligrams per deciliter, which used to be, well, unthinkable.
And these drugs are what make that possible.
They do.
So let's get into the mechanism. How do they actually work? How do they turn the liver into this super efficient cholesterol sponge?
It's really elegant. It all centers on this one protein, PCSK9. So your liver cells have these little receptors on the surface. Think of them like catcher's mitts for bad cholesterol.
Okay, grabbing it from the blood.
Precisely. They grab it, pull it inside the cell to be disposed of. Normally, that mitt would then go back to the surface to catch more. But the PCSK9 protein swoops in and basically acts like a destruction tag.
A wrecker.
A wrecker, exactly. It tells the cell, hey, destroy this catcher's mitt. So your clearing capacity goes down. A PCSK9 inhibitor simply blocks that wrecker protein. So the catcher's mitts survive, they stay on the cell surface way longer, and they just keep pulling more and more cholesterol out of the blood.
That's an amazing piece of molecular engineering.
It really is. It's incredibly precise.
Okay, so we've established they're great for the heart's plumbing.
Mm-hmm.
But when we talk about cardiovascular health, we're talking about the whole system,
The entire vascular tree.
including the vessels that go to the brain. So let's talk about stroke prevention. And we need to be clear here, right, that there are two main types.
Yes, very important to distinguish. You have the ischemic stroke, which is from a clot,
The most common type.
by far. And then you have the hemorrhagic stroke, which is caused by a bleed. For the ischemic stroke, the clot stroke, the story is just overwhelmingly positive. It follows the cholesterol data perfectly.
It makes sense. Less plaque in the arteries means less chance of a clot breaking off and going to the brain.
Exactly. The huge clinical trials, the ones called Fourier and Odyssey, they confirmed it. PCSK9 inhibitors significantly slash the risk of ischemic stroke.
Okay, so that's a clear win. But what about the other kind, the bleed? I remember there was always this background worry, right, that if you push cholesterol too low, you might weaken the blood vessels.
That was the historical concern, yes. For years, there was this theory that very low cholesterol might compromise the structural integrity of the vessel walls in the brain, maybe increasing the risk of a hemorrhagic stroke.
That would be a deal breaker. If you solve one problem but create a catastrophic brain bleed, okay, that's not a win.
It would be completely unacceptable, which is why the trials looked at this so carefully.
And what did they find?
The data is incredibly reassuring. It's a huge safety win for this class of drugs. The randomized trials found that PCSK9 inhibitors do not increase the risk for hemorrhagic stroke.
Even when cholesterol levels got super low.
Even then, we're talking about patients whose low-density lipoprotein cholesterol dropped below 20 milligrams per deciliter. Still no increased risk of a bleed.
Wow. So that specific fear seems to be off the table.
For this class of drugs, yes, it looks like their specific mechanism avoids that theoretical risk.
Okay, so let's move away from the blood vessels and deeper into the brain tissue itself. This is where the story gets really unexpected. We're talking about the potential link between these cholesterol drugs and something like Alzheimer's disease.
Right. And this is a shift from thinking about circulation to thinking about fundamental brain clearance or, brain housekeeping. The sources are indicating that this PCSK9 protein, the very same one that regulates cholesterol in the liver, also has a say in how well the brain clears out waste.
Wait a second, that sounds almost random. Why on earth would a protein involved in cholesterol metabolism have anything to do with the brain's garbage disposal system?
That is the perfect question. And the answer seems to lie in the shared evolutionary history of our body's receptor systems. The key is a specific receptor on the blood-brain barrier. It's called low-density lipoprotein receptor-related protein 1. We can just call it LRP1.
LRP1, got it.
So this LRP1 is part of the same big family as the cholesterol receptor in the liver. Structurally, they look similar enough that PCSK9 recognizes both of them. And this LRP1 has a crucial job. It's basically the main highway for getting amyloid beta out of the brain.
The sticky protein that forms the plaques in Alzheimer's.
That's the one. LRP1's job is to grab that protein from the brain tissue and physically shuttle it out into the bloodstream so it can be eliminated.
Okay, so LRP1 is the highway out. What does PCSK9 do to that highway?
It does the same thing it does in the liver. It acts as the wrecker. It targets those LRP1 receptors on the blood-brain barrier for destruction. So it essentially closes down lanes on the amyloid removal highway.
So if you inhibit PCSK9,
You save the LRP1 receptors, you open up more lanes on the highway, and the brain can suddenly ramp up its ability to clear out that amyloid beta.
that is a profound idea. A cholesterol drug that effectively unblocks the brain's plumbing system for waste. What's the evidence for this?
The preclinical evidence is it's pretty compelling. In mouse models of Alzheimer's, when they inhibited PCSK9 systemically, the amount of amyloid beta in the brain dropped dramatically.
How dramatically?
We're seeing reductions between 38 and 58%. And critically, this actually preserved cognitive function in memory centers like the hippocampus.
And the research confirms it's because of that LRP1 highway.
Yes, the source material is very clear. The effect depends entirely on preserving the function of LRP1 at the blood-brain barrier.
That's amazing. But, we've seen so many promising amyloid clearance ideas fail in human trials.
That's true.
What makes this different? Why is this mechanism potentially more promising?
The promise, I think, lies in how it works. Many of the failed treatments tried to go into the brain and, break up existing plaques. This strategy is different. It's about boosting the brain's natural export system. It's a fundamental clearance mechanism.
So you're helping the brain help itself.
Exactly. And what's more, the human safety data is there. The big cardiovascular trials, they specifically watched for cognitive problems. They found absolutely no negative impact on cognition, so at the very least, we know the treatment is safe for the brain. And the preclinical data points to a really promising path forward against Alzheimer's.
Let's turn to what might be the most complex part of this deep dive, the unexpected links to ALS and Parkinson's disease. This comes from those genetic studies you mentioned.
Right. This is where we have to talk about a method called drug-target Mendelian randomization.
Okay, that's a mouthful. Can you break that down for us?
Of course. It's a very powerful trick. So instead of giving thousands of people a drug and waiting 20 years to see what happens, researchers use natural genetic variations in the population. They find people who were just born with genes that give them a slightly lower level of PCSK9 activity their whole lives.
So their genetics are mimicking the effect of taking the drug.
Precisely. It allows us to model what decades of continuous drug exposure would look like. It gives us a really high level of confidence in predicting long-term effects on other diseases.
Like a genetic crystal ball.
Mm-hmm.
And what did this crystal ball show for ALS?
It showed a major potential win. The study found that having this genetically predicted inhibition of PCSK9 was linked to a significantly decreased risk of amyotrophic lateral sclerosis, or ALS.
Wow. For a disease like ALS, which has so few effective treatments, that is a massive signal.
It's a huge protective signal, and it absolutely warrants immediate follow-up.
That is fantastic news. But here comes the other side of the coin. Parkinson's disease.
This is the complexity. The very same study, using the exact same method, pointed to a signal of caution. It found that genetically predicted inhibition of PCSK9 was linked to an increased risk of Parkinson's disease.
And it wasn't just these drugs, right? The study also flagged statins.
That's right. The analysis suggested that statins, another class of cholesterol drugs, might share a similar risk signal for Parkinson's.
How can that be? How do we get these two completely opposite signals? A lower risk for ALS, but a higher risk for Parkinson's.
We don't have the final answer yet, but it forces us to see that the underlying biology is probably very specific, very compartmentalized.
Meaning what's good for one type of neuron might not be good for another.
Exactly. ALS primarily affects motor neurons. Parkinson's disease involves the dopamine-producing neurons in a specific part of the brain. The data suggests that whatever this process is, aggressively lowering cholesterol, inhibiting PCSK9, it might be protective for motor neurons, but it could be having a different, maybe detrimental effect on the very specific lipid processing that those dopamine neurons need to survive.
That distinction is so important. This isn't just a blanket effect on the brain.
Not at all.
And even though this is a genetic prediction, not a clinical trial outcome, that caution needs to be emphasized.
Absolutely. The benefits for heart health, for stroke prevention, and the potential for ALS and Alzheimer's are huge. But this signal about Parkinson's risk, especially for someone who might already have a family history or a genetic predisposition, it can't be ignored. It has to be a major focus for future research.
So let's try to pull this all together. What this deep dive really shows is that PCSK9 inhibitors are so much more than just heart drugs.
They really are.
This one class of drug seems to influence fundamental health systems all over the body. It's clearing out artery blockages, it's protecting against the most common type of stroke, it might be helping the brain clear out waste linked to Alzheimer's, and it even gives us a protective signal against ALS.
When you lay it all out, it's pretty remarkable.
Compared to doing nothing and living with high cholesterol, or even just using high-dose statins alone, these drugs are looking like a major step forward.
It's the perfect example of systemic medicine. You have a treatment for the body's periphery, just for cholesterol, and it has these profound dual effects on the central nervous system, both beneficial, like for ALS and the Alzheimer's mechanism, and potentially detrimental, like the risk signal for Parkinson's. It shows just how connected everything truly is.
Which brings us to our final thought for you to consider. We have established massive wins against heart disease and ischemic stroke. These are leading causes of death and disability around the world. We also have these new, exciting protective signals for diseases like ALS. So how will future medicine weigh those certain huge benefits against this smaller, genetically suggested risk for Parkinson's disease? Especially when we think about long-term prevention for people who might have a specific genetic risk for Parkinson's already. The future of this kind of medicine might have to be intensely personalized based on the very specific needs of your own neurons.